just if you have any feeling here. Does it hurt? Where does it hurt? Which area?
There.
Where? Here it is?
I can feel a prick right there.
Hey, just say when it is. Here, you need it?
No, use yours. Clemency. You need alcohol or anything? Gloves? I have gloves, alcohol. I have a box of gloves there.
Okay. Gloves, fine.
I'd like to introduce our next speaker, continuation from yesterday. Chris, can we start? Continue. See, it's happened for you. Dr. Gleditsch is going to speak on reflex zones and focal disease. If you want to move around, you can take that out.
So, we go on with our teaching, acupuncture, reflex zones, and so most of it may be practical now in our time we have left. Just now I treated one of your colleagues with a scar. When had you been operated?
About 8 weeks ago.
3 weeks ago. I used to give local injections of local anesthetics in all the scars after operations I had performed. For example, all the tonsillectomies, wisdom tooth extractions, but not earlier than 3-4 weeks after your operation, after extraction. Not in every patient, but all patients who suffer. Patients with headache, migraine, with functional disorders, with myofascial pain, or whatever it is. I think it's very important to do it. I have seen that many of patients, my patients, I had operated, for example, a tonsillectomy. There was not the fine result I hoped and the patient hoped, but after the injection, 3-4 weeks later, headache or migraine or whatever had gone. So it is a very good chance to do. The problem is we have so many scars. If you ask the patient to tell all the scars, so 1, 2, 3, 4, 5, it can be so many that you can inject, as Hunike taught us. We had to inject all scars in one session. I can't do it with all my patients. It's impossible. So I have learned to use it combined with my acupuncture needle. You have seen my little acupuncture needle yesterday. It's a very fine needle used for ear acupuncture or for face acupuncture. So with this very fine needle, I just had this method with this colleague here. I dabbed with this very fine needle along the scar several times. Not only the scar itself, but also the surroundings where it had been cut. Where it had been cut, but also it's situated. Or all the places that had been traumatized. All areas, it can be 1 up to 2 fingers near the scar. So you can have a feeling with a needle, with a very fine needle, but same procedure. Supported hand and just a flexible needle, a very fine and flexible needle you need. So you can go along the scar and ask the body. And the body will tell you, oh, here's nothing, it's nothing, it's nothing. So you can, you need not have your injection at these places for the beginning. So other spots will be very, very sensitive when touched by a scalp needle. So you know, the needle drops. And if you think that the scar, the tissue of a scar is very hard, but the needle drops at these very spots. So you know these spots have to be treated. And at the same spot where the needle dropped, I take my injection and put it there. It's very simply to explain it and to perform it. So I think you have understood what I mean. So even if patients have 6, 7 scars, maybe 2 primarily very sensitive, so I begin with these 2 scars and give my injections just at the very spots sensitive by dabbing needling. So if the patient is improved, but I have the feeling it has to be injected all the scar, I can do it later in another session. For example, if you would say it was fine, but there's some left that had to be treated, so I can do it next time and have injection all along this scar. But in the beginning, it's also a rule, a law of acupuncture. But for my opinion, the same in neurotherapy. To begin so little as possible, not with a very big program. Do very little with your patients. In acupuncture teaching, we have been taught to differentiate our patients if they are a yang or a yin. You know what it is. If they are in surplus or in deficiency. I have to tell, after being engaged in acupuncture 30 years, I'm not sure in every case or every patient how he is. So I have seen there were many mistakes with my decisions, but also with the masters that, who had been my teachers. So once more, for the beginning, for the first session, learn to do just few points, few needles. You don't know how the patient reacts. In all kinds of regulating therapies, if it is neurotherapy, if it's acupuncture, if it's homeopathy, we have the, what do you call it, the worsening, the beginning worsening, which can happen. Aggravation. The aggravation which can happen after the first treatment. Very, very seldom after second, third treatment, but when it is, it begins with the first treatment. So first treatment has to be done very, very careful, very reluctant. Do so little as possible. See how the patient reacts. So next time you know better what the patient is to react and how you can do it better. But this aggravation, it's no problem with the aggravation. It means if patient get a little pain after acupuncture treatment, after neurotherapy, after homeopathy, that means that the auto-regulating system of the body began to work. It was activated, but maybe activated at a too high level. So therefore begin with very few needles and with a very soft treatment. So we just had 2 points. I injected 2 points of a scar. A scar was about such a minute. So and just the ending of the scar. We're very sensitive, so I just had my injections done there. Was a lady we had treated yesterday. Is she here? Yes. Can you tell you a little? Tell a little what it was.
When I was coming in on the plane, I don't know what happened, but this whole side was just, I was in excruciating pain. All the way through yesterday, I couldn't even sit here and listen to the lectures. It was just so excruciating. I kept going out, holding this side of my head. It was just like all the pressure was from the plane, from landing. It was like it never left. And so I went to him, and he did a little bit of acupuncture. In 2 minutes, the pain was gone. I was moving my head. It hasn't come back. I myself.
But we have to tell what we did. So we have to learn. This is a real problem for also our specialists. For example, an ENT doctor. If you might have gone to an ENT colleague, he would have looked at your eardrum, and he would have looked in your sinuses. But
He would tell me I would have an infection or
yes,
something.
he would tell you you have an infection, you have got your antibiotic, and you would, you know what. It's the same story. And we see this story so very, very often. And after I've been now ENT in 30 years, such stories haven't been 30 years ago, not 25 years ago. They began about 15 years ago. more and more. So what I used to tell, that our diseases have changed. Our diseases have totally changed. When I was trained as an ENT, we opened here the sinuses, what we call the catalogue, you know, with a very big window. Here, such a big window. And then we took out all the mucous membrane. This was an operation, and we were very proud what we have done. Now I am ashamed what we did. For in university medicine, no more does it in Germany. No more. It's a mistake to do it. And even elderly ENT doctor in your country, maybe so as I am, does it, sends the patient to another doctor. For now the ENT doctors are taught to have, if they operate the sinuses, just endonasal with a very, very, very small opening, and keep the mucous membrane so much as possible. Don't touch the membrane. This is the professors teach now in Germany. They have begun to operate under the microscope the sinuses, under the microscope. So it changed in 30 years. When I was taught, an ENT trained 30 years ago, just, you know, as I told you. Every third patient in Munich, my place, had been tonsillectomy. If I looked at him, no tonsils, no tonsils. Oh, wonderful patient, he has still his tonsils. So, totally changed. We are not allowed to take the tonsils. It has to be a very severe indication if we do, because of the immune system. So, what I tell you, during the 30 years, I can have an overview of this time. We have totally changed our procedures, but the diseases have changed too. I remember when I did maxillary surgery in the clinic, university clinic, we had every morning 4, 5, 6 patients with a submandibular abscess. When did you see it last time? We had it every morning. It was our work before breakfast. We began with it. To open 4, 5 such abscesses submandibular here, every morning. Gone. Then I changed to ENT. I had every week 4, 5 abscesses in the tonsils. 1, 2 a year now. 1 a year. It's a high level. So what has changed is our diseases. We have no more the same diseases as we had 30, 40 years ago. And the medical science is not as quick to change the methods. The young professors, they begin it. They have understood we can't go on with the same method we had before. So, talking about acupuncture, it's wonderful to say what Chinese doctors have done 2,000 years ago is still valid nowadays. We can do the same work, the same points, the same treatment, the same depths of needle insertion. Everything is still the same after 2,000 years. But our modern medicine, after 30 years, totally changed. The remedies I used in the 60s, in the 70s, forbidden now. Nobody talks about it. They are gone. Many of them. Think what a time. We are very modern, very scientific, but that was as valid today can be the mistake in 10 years. So it's very, what do we say, very unreliable. So, but go on with, we will go on with this case. This pain, history we had been told by you, it's an pain caused by the yes, and what happens? It's pressure difference. It's a pressure difference, and it gives stress to the mucous membranes. But why on the left side and not on the right side? Why? she has a problem on the left side. It was before. And this is so very important to learn. I have seen that most problems in our normal practice, that patients come with, for example, with an elbow or shoulder complaint, or such a case that we had been told. But this is not only a story of acute symptoms, but it's a story that comes up at a special area which is stressed for many weeks, months, or years. I will tell you stories, for example, here with elbow complaints. Patients coming for treatment. 3, 4 orthopedic doctors tried their best. Nothing helped. I looked in my documentation in my practice, so I remembered the patient had been with sinus treatment 10 years ago, 20 years ago, and had problems with sinuses for such a long time. This is a meridian, as I told you yesterday, for mucous membranes, the sinuses, as well as in the gut. So, if there's an elbow problem and we don't treat the deeper problem, and the deeper problem is the gut, the mucous membranes, the sinus, so we can do what we will with cortisones, with pain killers, whatever we do, the patient will say, "Oh, it's not better, a little better," and he is not cured. So acupuncture teaching and reflex teaching, we can learn by it that all what is happening with the patient, for example, your left side, there is a problem. There's a problem with your nose or with your sinuses, and we had to go on with the treatment and look what it is. I could help you yesterday very quickly. I used 3 points here. And this is a very important point for all your dentist works. All this area here, I call it the lymphatic belt. It's a belt, can you see it here? In this level. The level of the upper sternum, as I told you yesterday, point here. But it's not only one point, it is like a belt. Take the microphone. It's like a belt. And this belt has the special point and the best point in the midline. But there are some more points, right and left, in the distance of one little finger, left, right, same areas. But you have the same points on the back side. It's at the level of the 7th cervical spine. You can palpate by your finger if it's more sensitive on the front side or on the back side and give treatment there. What happens when you treat that? The lymphatics that are in tension, Dr. Voll, he called it a lymph angiospasm. The lymph capillaries in spasm. And by a reflex therapy, the spasm is opened immediately. And if patients have a swollen area here in what do they call it, in the in the angle here, behind the mandibular angle here. Yeah. If there's a little swelling and painful in many cases, it's gone in seconds. If I put my needle in this area, you can keep your finger here and it's gone. So we have to learn that this is a barrier here. Think of what they have been taught by Klinkert and by your name, Ara and Dietrich this morning. It's a problem of the autonomous. So autonomous, we have been taught this morning that this area here is the vagus regulated area. But up from here, it's the sympathicus regulated. So we have a borderline here. And this borderline is in many cases interrupted. It doesn't work well. So we restore the borderline between the area of the head and neck and the body under it. It's a question of the harmony, the regulating between sympathicus and parasympathicus, vagus. So all this what we do in this line is a kind of regulation in this area. I have to teach some more ideas to finish our acupuncture teaching. In acupuncture teaching, I don't tell you news. I am sure most of you have been trained a little in acupuncture, and if you see this, you understand what it is. Acupuncture talks about polarity. Polarity means that we have two poles. And the most typical is that we have the upper part and the other on the below. And the upper part, there you see yang. Yang, Himmel is the same word, heaven. And Erde is earth, yin. So all meridians in head region are yang. All meridians in head region are yang. Yin is only to be found in the extremities and in the lower parts of the body, especially in the lower extremities. So acupuncture teaches us that we have to give a equilibrium, a balance between the upper part of the body, Himmel, heaven, upper part, symbolic, you understand what it is, and the other, which is yin. So if you would say it with other words, the head is yang. Why is the head yang? Yang means active. Yang means very reactive, also in working. So if there's any inflammation, if there are any detoxification necessary, the organism like to do it in the head region, because the head region is yang. There's a power to do it. Therefore, in dentistry, we have or in ENT the same. We have very active mucous membranes. They have the ability of detoxification. The problem here in the guts cannot be solved in this area. So the organism puts the problems up to the head, and here it is solved with the mucous membrane in the head region, because this is yang. Here's the power to detoxicate it. So therefore many of our problems which are originated here in the lower parts, not only the guts, it can be in the urogenital or whatever, but many cases they are put up in the head region, and here the process goes on. So we have to understand yang is active, but in a good way, because it is processing. It's active in working. But in pain situation, it can be critical. If patient has headache, trigeminus, orofacial pain conditions, and we give him needles or injections according to neurotherapy, it can be too much activity here. It can be over-yanked. Over-yanked? Okay. So it can be overburdened. So in this case, what do we do in acupuncture? Keep away from the head. Where we go to the hand. Here's the point here, number 4 of large intestine. Go to the feet. Wonderful to treat headache by feet points. But I know for a dentist, not only in your country, same in Germany and in Europe, it's difficult to say, take off your shoes, I will treat you with needles there. So it's very fine that we can do every treatment in the head region without being depending on this yin-yang. Because the microsystems, and these are reflex systems, the microsystem of the auricle, here of the earlobe, the microsystem of the mouth, the microsystem according to Yamamoto in the temporal region here, they all are free of this problem. So we can treat by microsystems, and we don't interfere with this yin-yang problem. So if you are not prepared to treat from the foot area, you can treat by the ear, you can treat within the mouth. And this is a message for you as dentists, that you can do the treatment in every case in the mouth, independent if it's yang or yin. So it's very important for us to know. We need another information. It's this one. You have it in your map. You have seen it. We can have a little more light on. It's too dark. You have it in your... Yes, you know it. Have a little more light on? Okay. What we can read in this, you understand me? You need a microphone. I think you understand. We have 5 groups. I can put it. We have 5 groups in each quadrant. Right, left, upper jaw, lower jaw. It's the same, beginning with the kidney and bladder, with liver and gallbladder, with pancreas, spleen and stomach. What does it mean? These who are, all who are familiar, a little more with acupuncture, know that we have 12 meridians. And these 12 meridians are divided in 6 yang and 6 yin. The yang are the small intestine, large intestine, stomach, gallbladder, bladder. But we have also the yin in the oral cavity. We have the heart, the lungs, the pancreas, spleen, the liver, the kidney. What is the question now? How many it is? 10. But we have 12. Where they are? 2 missing. What is it? What? Yes, but what is it? Circulation triple warmer. Circulation triple warmer are not included in the teeth system, according to Voll. This is still the Voll system, elaborated by Voll and Kramer. I told you yesterday. Voll did all his all this research work for diagnosis, but he had not the idea that we can treat by all these areas. He just looked for the teeth and the correlations to the organism. But it was very important to find out that in the mucous membrane, adjacent to the teeth, we have the points to enter these systems, to treat these systems, or to be aware which of the systems is in functional disorder, because what does it give for signs? Sensitivity in the mucous membrane. We can palpate it. We have seen yesterday. So once more, we have 5 groups, and each group is a double group, which means not only a yin, but a coupled yang meridian. So we have 2 meridians, meridians that are correlated with one another, very, very near correlated. Kidney, bladder, it's clear. Liver, gallbladder, that's the same for each group. So these 10 are now completed by the other 2, circulation and triple warmer, sitting on the ascending mandibular. You remember yesterday that we had our palpating done first in this area, near the sulcus, and here it's a alveolar bone, but then I went up the ascending mandibular, you remember. And in this area we find the triple warmer. And triple warmer is also, you can do it. Triple warmer is also combined with circulation, pericard. So we have 5 groups correlated directly with the teeth, and another group in the ascending mandible region. I've seen many patients with migraine, for example, painful in this area, ascending mandible. That means, if you think of Voll and Voll's teachings, triple warmer is correlated, look at the apparatus standing in the room, with endocrines. Triple warmer is correlated with endocrines. So many of our patients with migraines, there are problems with the endocrines. So we can treat it by these areas here. Now, if we realize that these correlations to be found in the oral cavity are so important for every dentist in every daily work we do. For example, if we have there a canine tooth that had to be operated, apectomy, what do you call it? Apodectomy. So it can be okay. Or if you have an implantation. So, but if the patient, I had such a case it was in January, a friend of mine, a dentist. He had a hepatitis B and a hepatitis C, both. And he was told by his friends to be operated here. What would happen? It would work. It would get worse. You can be sure. So what we have to learn, each operation, each planning in our daily practice has to be done in accordance to this system. If the patient has a problem with the liver, hepatitis, alcoholics, think of it, or other problems. So be careful. If it's a problem in the urogenital system, that means kidney bladder. Kidney bladder, that is Chinese. They couldn't understand what is urogenital, but we know it's urogenital system. There are many patients, female patients, that have been operated here, total operation, what do you call it?
Hysterectomy?
Yeah, a hysterectomy. You can't do with such patients implantation or an appendectomy. So ask the patients in the history what they have had for troubles before in their lifetime, and so then you decide what to do, and then you will give a good treatment and have done a good decision. This is very important to know. The other to tell about these correlations between teeth and all functions of the organs are vice versa, in both ways, bidirectionally, mutual intercorrelations. That means also the organisms can send their signals in the systems. And it can be painful in the mucous membrane. And it happens sometimes, even in patients that have been extracted their teeth and they have their denture. Sometimes patients come to a dentist. I remember my dentist time. They had their denture for many years. Everything was fine. But now, it works, it hurts. So what do we do?
Just a denture.
Just boring.
Right.
But in many cases, if there is no ulcus, stop and ask which area is it. Oh, it's the stomach area, and give a treatment instead of boring and do some, and patient will be cured. Our thinking is primarily mechanical, but mechanical is the one necessary ability in dentistry, but the functional thinking is as important as the mechanical. So don't only think of if there is a pain with a denture that it has to be caused mechanically. It can be caused functionally. And functionally it means that it is a signal from this system correlated. And if you treat it, and you can treat it either directly here, or, remember yesterday, what can we do? Instead of treating in this area, I can treat in the same quadrant retromolar. Remember? I can either treat here in the points situated near adjacent to the teeth, or I can begin with the treatment in the same area, in the 9-tooth area of the same quadrant. And then I have another palpation or another checkup if this pain in the mucous membrane is still there or not, if it's gone. If it's gone, okay. If it's not gone, you can have another injection here too. What's the other possibility? I can give a treatment on the other side, left instead of right, or both sides. So just to give some ideas what we can do with patients who are our problem patients, where we don't know how it came up with this pain condition. So once more, the system in the oral cavity is a system not as we believed in the beginning, that it would be just the area of the tooth and all what is very near to the tooth. Folk called it for odonton. Have you heard about it? You know it. Odonton, he means the tooth and the tissues directly correlated. Parodontium, gingiva, very near surrounding the tooth. Now we know a better thing. It's quite a long stripe going out from the tooth, long out up to the lips. All this area in front of the teeth, of every teeth, goes out to the lip or cheeks. And you can also treat outside here in this area of the cheek of the lips. So it's the same what we have been taught by Dr. Noger of France in the auriculotherapy with the ear. He told us that there are lines coming up. Lines where several points are situated just in a direct line, lined up as if you could have a, what do you call it, a lineal.
Ruler.
Yeah, a ruler on it. And the same happens here. You can have points sitting outside, here, there. And so what Voll called odonton, now in our new interpretation, means the same what he told, but it's going on along the mucous membrane up to the lips, the cheeks, till it comes outside to the place, to the skin. Very interesting. What is the result of this new experience? We can treat a beginning pulpitis just by touching with a needle outside the skin, but also inside the mucous membrane. But the very interesting is if you have the little needle touch. You have the needle touch in this area, for example. You go with a tangential, not vertically, but tangential needle along this area. And oh, here it is. And there comes a little drop of blood, very little. The Chinese call it a microbleeding. Bleeding. Just 1-2 drops, no more. But this changes the situation. Same as I told you yesterday here for the acute tonsillitis and pharyngitis, which we did in this area of the large intestine meridian. So it can change the situation very quickly that patient says, oh yes, pain is diminished or pain is gone, the beginning pulpitis pain. So we have to learn. You know, a pulpitis is a very critical situation because the apex is so narrow and the blood circulation has no other way to go out and to overcome the problem. But you can help by including all the system, all the network which is correlated with the tooth. And this network, the system, goes out of the tooth and the mucous membrane out up to the skin area. And if you hit the very point and you struck the very point and it's bleeding just a little bleeding, so it can change the whole situation also in the pulpa. That was the question?
The patient that you did here for the jaw area where she had the infections, you treated the sternum points here, so
Yeah.
you used the jaw energy down here. Are those points that you use very often for the head neck area?
The same yesterday when I treated her, it was bleeding in this area. But much more typical it was, there was another was treated yesterday. Was you?
Bob?
Who was it?
No, this morning.
This morning.
Yeah.
And yeah, and your shirt was still full
Just a
of
little microbleeding.
it was no micro, it was macro bleeding. I just touched with a scarp needle this area again, same area here, in the lymph belt area. And it was bleeding, not a microbleeding, but it was full bleeding. That if you look at him, his head this morning, it was a very red head. What does it mean? It's blood, okay, but it's also yang. It's very much yangy. And this yang from the head has to be same, solved in a way. And in this area, again, is the area to solve the head problems. So if it's bleeding here, the over circulation and the over yang situation in the head is diminished. So therefore I did this treatment here. And did it help?
Yeah.
Fine.
Do you always do symmetrical?
I prefer to do symmetrical. This pain situation was on the right, was it? Yes. But I did on the left side, and on the left side this was bleeding much more than on the right side. So, can happen.
On the lymphatic belt, do you do the dabbing?
Yes. I do the dabbing. I do the dabbing at the lymphatic belt. So, you understood that the lymphatic belt, it was an idea which is not elaborated scientifically. But after all we had learned during the last time, also what we learned this morning by Dietrich Klingert and by Ara, that was really the vagus situation. And the contrast between vagus and sympathicus has a borderline. And this borderline is in many, many cases overstressed. So we can change the situation just by touching these areas here. It's very helpful to regulate the homeostasis between sympathicus and vagus.
For a low thyroid condition that does not have an obvious pain situation, what points do you use?
Thyroid situations, it's a very similar situation. It has to be checked up, it's clear. But we have learned that especially with young people, they can have a little problem here with the thyroids, juvenile thyroids, we call it in German, juvenile. So if you treat them by lymphatics, they are cured. But once more, they have to be checked by the internal specialist that there is no other problem with the endocrines and so. But in many cases, especially with young people, there is no problem. There's just a little lymphatic swelling on it. And this can be cured by such reflectory points.
For a person that's hypothyroid,
This is another question.
is there points
Yeah,
that you
yeah.
use?
This had to be treated as normally to be done with.
Endocrine points do you use?
But if you will give a little help, additional, you can do it with these points, also these points out of the thyroid here, the two special points. These points are very sensitive. And there's a special point in the ear lobe. We can put it.
What about Kunicki's thyroid injection at the four
Yes.
poles?
This area of the ear is the area of the thyroid. Yeah, very good. So, if you just touch this area with a finger, just going this way with your finger, not the nail, with the side, with the finger side. If you just do it with the finger side, you can feel with such patients that they're very sensitive in this area. So I put a needle there and I put needles here, or I give the injections according to Hunicke directly in the thyroids.
Would you like to demonstrate?
Yes?
Could I be your
Okay.
person?
Okay. So, more light.
What happens when the thyroid's gone?
When the thyroid is gone, think of the scar. I've seen that many patients with problems after thyroidectomy, they have very sensitive scars. And once more, think of the midline meridians. We have not yet mentioned our midline meridians, but we talked about 12 meridians, you remember. We call it the main meridians, but there are two more. And these two meridians are the most important meridians for the dentists, because, why, you know? This one begins in the area of the symphysis, genital area, and goes up in the midline, umbilicus, sternum, here, okay, here's a point you remember, gagging point, but it goes here to the frenulum inside. And that means this area here is connected with this area. So you can treat problems in this area by injections or by needles very near to the frenulum. Prostate problems, gynecological problems. You can treat gynecological problems. Thanks.
I'll translate.
You can treat just doing here the treatment in this area. Very simple. But I give you another.
Do you want to do this now, or the thyroid thing?
Okay. You know, we have two such systems. The other system is on the back side. You know the names of these systems? governor vessel and conception vessel. But both words are not correct translated from the Chinese language. Governor, what does it mean, governor? It's a man in his authority, a man, a ruling person, like a crown on his head. It's standing upright and he is man of authority. And conception is not the real word, it is serving. The conception means serving person. So, again, it's yin and yang. Yang, it's a man in his authority. We are in our profession with our white coats and so, oh, doctor, we are. But our profession is a serving profession, a social and a serving profession, is it? So we are both. We are yang and yin in the same way. So, again, to come in harmony with both, not only be a very proud doctor, but the other one, but not only be everything what the patient wishes to be done. No, it's no authority. To be humble. Yes. So you see again, it's a very fine the thinking of the Chinese, the harmony between two contraries. The contrary here is the dorsal system, and the dorsal system, where does it begin? It begins in the anal area and goes up the processus spinosi, cervical spine, comes to a wonderful point here. Who did treat these points here? You know it, 3, 4, 5 of you. I had a lady doctor, lady dentist, in a seminar some weeks ago. She told me, if a patient is very nervous, sitting in the waiting room and talking, that all the other patients getting nervous too. So, come in. So she sits, the needle here, put out again, and all is silent in the world waiting room. So very simply done. How do you find this point? It's the uppermost area of the ear, of the earlobe. You go up in the midline and put the needle not vertically but a little tangentially, this way. So here. You will find the point by your fingertip or by your fingernail if you go there. If you are a little nervous or if you have a problem of sleeplessness, yes, it's tender. So put a needle there and you have a better sleep and you are relaxed. So a very fine point for relaxing, but especially also for such patients as I told you.
Aren't you supposed to put the needle in the direction that
You can do it.
meridian goes rather than against it?
We do it in this way and in that way. I have been taught by Chinese professors this way, but in my opinion it was also the direction of the meridian is the other one. But it's stopping, yeah. But now again, what is the meridian running now? From this area running over the very important point, you know this point? Yes. Yin Tang point, it's a very important point. Think of the Hindus, it's a chakra point. It's going here, and it's coming this, remember this point? Collapse point, we talked about yesterday. But then it is here inside the mouth. And inside the mouth, this area of the upper frenulum, what can we treat by this area?
Genital urinary.
Yes. We can treat anal problems, hemorrhoids. You can treat anal fissures. Anal fissures is a crux medicorum, you know. But I have seen some patients in an early state. I could cure them just by little injections near the frenulum and the upper jaw with anal fissures. You know what this is? It's a very big problem. Very difficult to be operated. Yes. So think of it, if you have patients, you can do it as a dentist. It's your field. It is your field. But also think of it, what these two lines, the ventral line and the dorsal line, what they connect, what they are, what is linked together. This area with the mouth. Think of Freud. Okay. Now. So.
That sounds good.
It's pain for you?
It's the blood tests show that my TSH levels are off the scale. That's
The main sensitivity. ask the finger palpating, and I asked here a little palpating the thyroid. Some patients can't tolerate it. They're very nervous when you do it here, as they cannot have a pullover or a tie here up, so they need it very open here. But I can do it. It's not so painful here.
No.
But if I come here, you see, it's very, very sensitive, this area. If I go to this area, here, so this area is again very typical here. It's a very point for changing the disharmony between vagus and sympathicus, head region, and the other part of the body by treating this area. We can have another try if you sit on the other way. Yes. So I will have a palpating done on the back side. So I go with my finger along the cervical spine, processi, and feel it?
There.
Just with my side of the finger. See how I feel it? Yeah? So I can treat it from dorsal and ventral, and I can have another palpating done in the earlobe. You have seen it before, and ask how is it here. So, okay. So I can treat. This is reflex therapy. I didn't learn it by the Chinese, but I asked my finger, and my finger told me all the stories. I'm sure you will find much more fine points if you ask your finger. Ask your finger and ask the patient. I think the reflexology has just begun in medicine. With the ancient, wonderful tradition, teaching of acupuncture, we will never come into the universities. But with reflexology, I have seen teaching such a point here for gagging, such a point for the lymphatics. They say, yes, come. So we have to go this way. And later on, we teach the action. We have first to be on the door. Yeah. So now we have 2 needles. I take the. Oh no, skates.
No, not always.
Now again, I have the needle in the midline. It's difficult for me if I'm standing on the back side, better if I do it so here, but I hope I'm in the midline. So I have it. You see the needle is vibrating a little. The flexible needle tangentially going down, and I ask where it is.
There.
Yeah. The patients give a very typical reaction, saying yes, and you see it in the eyes, you see there's a mimic reaction. And at this very spot, you put the needle, and you feel it if you have the needle vibrating along this area. This same spot is much as less resistance under the needle tip. You feel as if the needle drops in a little channel. So take the chance and put the needle there. And now we can turn to the now I put the needle on the dorsal side, and look here, it's very, very, say,
Erythemas.
erythemas, yeah.
I don't know what that means then.
Red. Yes, it's very red. So, the same procedure, the hand is supported. You can't understand how difficult this is to teach general practitioner to support the hand. The injection. They do. They have been taught to do, but every dentist knows we can do it very gently.
The midline.
That was midline. It's a midline. And if it was not cured totally now, I would ask nearby about 1 finger, small finger, right and left, if they're still a little sensitive. Not on the front side.
You see red front too.
Yeah.
No.
Now I ask in the ear, changed.
Less, much less. Still
Still
a
little.
little bit. Not like
So it's
before.
better we have a little, maybe have in the ear?
Oh, yeah, yeah.
Okay. The same. Okay. I wait to get just it's very sensitive, very, very hard. Here, feel the hands. It begins, it's a very strong vegetative reaction. But this is what the organism needs to change many of the regulating mechanisms. What we do is that we give impulses to an auto-regulative system. Not we cure the patient by our needle, but the patient cures himself. We only give the impulses, and the very deep impulse is the autonomic nerve system. And the autonomic nerve system is best met by points here in the lymphatics, ear points, and mouth points. Don't forget mouth points.
Yeah, it's making me feel very emotional.
Okay.
It's
You want to lay down?
no, I'm fine. No, I'm used to this.
That's
It's
very
okay.
fine that
That's,
you.
that's good.
And
It's good.
if you have lost some tears, let it go.
I feel it. I feel quite
Yeah.
emotional. And just
Quite enough.
It's because you work for Ira, that's why.
I should be used to this. No, it's good.
I see. What is here? We have to learn it. And thanks that you are so honest with us.
No,
Thanks.
it's good. Yeah.
Now take it very serious here. What happens is that we get free with our emotions. We get free. Our emotions in many cases are over-adapted. We say, oh yes, everything is fine. Fine with my profession, fine with my husband, fine with my children, fine with my grandmother, fine with my mother-in-law or father-in-law. But it's not fine. So the body tells us the truth, what is not in harmony. We can try to come in harmony, but the body needs some help. And you understand how it is.
Oh, absolutely.
Absolutely.
Receive this.
And,
Yeah.
and tears coming out is the best medicine I ever seen.
When she walked up, her thyroid efficiency was 12%. You did your first acupuncture, it went up to 20. The last needle in the ear took her to 62% thyroid efficiency. The thyroid also represents blocked communication.
It's not been spoken to others.
Yes.
Right?
Needing to speak something that has not been spoken previously to someone else.
Now it's time to say.
Yeah, tell us.
I tell you a very nice story about a very same case. It was in the dental boards institute at Munich. And so we were a group of dentists, and I had treated a point here at the sternum. It was a young dentist, about 30 years. And I just demonstrated the point and asked, is one of you a little sensitive in this area? Yes, he said, a little sensitive. Come up, and we had to find dental chair. Not so like here, and so we had a dental chair, and he was lying, and I put the needle at this place. And as he was a man, he couldn't be so wonderful as you, that he really began with his eyes, that you could see what happened. But he has just been changed in his face, totally changed. And we asked him, what is with you? The man, you know, he can suppress all his emotions. And I felt his pulse was fine, and we asked him, oh no, everything is okay. I tried to go on with my teachings. Nobody listened, nobody. All looked at the face, that something happened. So I said, now, break time. Go, drink your coffee, and I remained with the patient in the room, just we two. It began the same situation. Tears coming, crying, and so when the group returned after coffee break, he told the story. And it was a very fine story. This young dentist had a little 1 year's baby at home. And this was very sick, came to the hospital, had been for several weeks in a hospital. It was a very severe sickness. It had come home 10 days before. And every night crying several times, and the little baby would only sleep between mother and father in the bed. So the dentist, the colleague, he couldn't sleep during these days more than maybe 3-4 hours every night. So with his nerves, he was very, but you couldn't see it. He was a young man, 33 years, It's wonderful outside, but inside. So a wonderful story. For he told us his problems, and then I get a telephone call from him. 10 days later, he said, Gleditsch, what I did, from Wednesday to Wednesday, I sent home my patients, and I went in the mountains, walking up with a hiking, and had it fine, no family, no patients. You can put your needles, or you could put your finger wherever you like. I'm fine now. So sometimes we need no treatment, we need some holidays.
Yeah, apparently.
Okay.
Okay.
Thanks.
Thank you.
Thanks for coming.
Jochen, you mentioned the gag reflex point. Is that, which point is that? The gag reflex?
Gag reflex, this one.
The right, the lower?
Yeah, in the middle. In the midline. Thanks. Thanks for your help.
Why did you only treat 1 year?
Yes, I could have done them both. After this reaction we have seen, it was better to finish. You understood? It would have been over-treated if I had another needle. So I finished. You understand? Good. It's a very good question. You have, yes. So, once more, these midlines, we can have our slides. Was it possible to have our slides? Fine. So we can go on with the slides for this the same idea. Chinese had just 2 points within the oral cavity. And this were these 2 points. The frenulum points. They were well known in Chinese ancient teaching. In the upper jaw and the lower jaw, the end points of the midline meridians, the conception vessel and the governor vessel. But there is no other meridian, no heart meridian, no small intestine, large intestine, lung meridian. All meridians are followed by another one. Little more light for a moment. Thanks. If you think of the large intestine meridian we talked about yesterday, it was the last point here in the nasolabial area here. Okay? But the next point is the point number 1 of stomach meridian. And it's just this little distance. Last point of large intestine here, first point of stomach here. And same goes on with all meridians. The end point of one meridian is very near to the beginning point of the next one. So it's a chain. Chain? It's a very long chain, one following in the sequencing, one following the other one. But in these systems, end point at the frenulum, end point at the frenulum, what is it? So Dr. Voll had the idea. He was a genie in all his thinkings. He said, why not that they are linked with one another in the oral cavity? Why not? I'm sure it is. So we find all the points in the vestibulum, near the sulcus, and where would they meet, these 2 meridians? In which area? Retro, molar, wisdom tooth. It's okay. So we understand that what we called the yang on the back side and the yin on the front side, or the authority man and the serving man, or whatever you will define this problem, it is linked together within the oral cavity. Also the problem with vagus and sympathicus. So in the retromolar region there's a very important region which harmonizes different polarities, which harmonizes all what is going on within our polarities in many, many matters. So therefore I believe that retromolar region and wisdom's teeth is the best region we can do in dentistry for treatment. But we have to learn, if we talk now about focus, the interference fields. If you think of the teaching of Hunicke, he told us, he began 60 years ago, more than 60 years ago, and he told us that most of the interference fields of the foci are situated in the head region. Most of these in the in the area of the teeth. Most of these. Second, tonsils. Third, sinuses, and then long distance, and then coming gallbladder, appendix, or whatever. But most head region, and within head region, dentist areas. And within dentist areas, the wisdom tooth area. Again, the same. But now, we can say, if it is such a sensitive area, which can give so many troubles, so many problems, it is in the same time the best therapeutical field we have in the oral cavity. So nature is not, what do you say, not
Biased?
yeah, it gives a balance. It gives a balance between problems on the one side and chances on the other side. Big chances and big problems in the same area. Is it?
Yeah. True.
Big chances and big problems. So we can do our best.
Is there a corresponding point on the skin surface that you might reach this area by?
Yes, but it's working better here.
I'm not a dentist, you see, so I'm looking out there.
Mhm.
Just wondered if
I will treat later on, or we can do it now. If there's any person here with problems in the hip or knee area, maybe? So we can have a try. You take my microphone. Sit here, fine. You have problems?
I got
Left.
most of my left knee gone. It's got
What was it?
soccer,
Accident?
Soccer injury.
Soccer.
Soccer?
Soccer.
Football.
Football. So
Football.
yeah.
Give me a microphone so you guys can talk.
Okay.
Football injury left knee.
Good. So, I just have a little palpation. Okay. Little pain for here. There's a little pain inside. If I compare right side and left side a little, you feel it here? It's a canine tooth. The tooth for hip and knee. And now I go on here.
That's it.
There's another pain in the ascending mandible. Which meridian? You remember? Triple warmer. And now same in the
Yeah.
again.
Thank you.
Thank you.
Right there.
Good. So now I have another detection with a fine needle outside the mouth, just to answer your question. And the point, if it is to be detected, I will try. I have to look where the canine tooth is situated. It is 1, 2, 3. This is a canine. Yeah. So it might be here in this area. Close the mouth. Fine. Ready? You heard it.
Yes. Nice shot.
Can you repeat that for the microphone, please?
Yeah, Allah, yeah.
A little autonomic here.
Yes. Give it.
Yeah, it's freer, much freer.
It's much freer. It's just
It's
one.
always very stiff.
Yeah.
Muchas gracias.
How many minutes?
Not more than
It's, yeah, seconds. It's 30 seconds.
And does your body sweat?
It's a sweat.
Whoa. Yeah.
Yeah.
All the way through.
Oh yeah. Look here. Wow.
Look at his head is all sweat.
Look here. Look
Oh,
here.
yeah, the bald spot.
Without a deep regulating in the autonomous nerve system, we can't get such reactions. Therefore, it's very important to just to get the point very precisely, on the very, very spot. And in the very spot, it's very sensitive.
Oh, yes.
Is it pain or what is it? How would you describe
you just
it?
know that that hurt. I mean, I don't know what else to tell you. It was very sharp. It's a very acute.
You feel deep injured.
It's a very, very sharp, I don't want to say biting, but precise
Yeah.
spot, but once it's in, it's gone.
Yeah.
And let's see, what do you do when the thyroid's gone?
But
I
now-
don't know. Oh, you want? I'm
Uh,
just offering spots for you.
I could have done the same treatment from inside. If I open the lips and give a little, you know what I mean. If I give it,
Flick it, you mean?
so you can see that the needle tip gives a little motion inside the lip. So it's precise the point I had been injecting inside. So it's like the same inside, outside, connected from inside and outside. In ear acupuncture, all who are a little more familiar in ear acupuncture, there we have a point for the knee in this area of the fossa triangularis. But we can do it here from the front side of the ear, but we can also give another treatment from the back side of the same point again, as if the needle would be stuck through. But we never do it. We never do it here in the lips. But in ear acupuncture, we have been taught by Noget, if we use the other point on the back side too, it gives a stronger reaction, especially according the movements, the motorics. And in the area of the lips, it is the same. I can treat from inside and from outside both. And the outside is a little stronger reaction for the motorics. For the inside more for the pains and the outside more for the motorics.
Now, is it important to treat unilaterally where he has the pain, or should you treat both sides?
I can have a look what is in the right side. It might be
Okay.
better to treat both sides. Yep.
Oh, it feels good now.
He says he feels good.
No, but
I may finish.
But seriously, it's unreal.
palpate those signs that he was thinner and
Yes.
initially.
Thanks. Very good idea. He said I may have another palpation what is inside now. Gone. It's gone. It's gone. But there was the other points.
Yeah.
The ascending mandible, gone. But upside here,
He's just did one of those illegal.
Oh, I don't care about the needles.
okay. One needle, we finish. We finish. Better we finish. Good.
Do you want your needle or you want?
No, you can keep it for 10 minutes. But this is your field. Lips is your field. If you do treatment here, you can cure the patients and you don't do anything which you can be prosecuted. If you say, please open here your trachea and I will look at your knees, and you put a needle here and put a needle there, you have not the same effects and you are very in a dangerous situation. If you do it here, inside, outside, it is your field. You can do it. What Dietrich Klingert said to us this morning. Stay in your field and you can cure all of its shoulder complaints, hip complaints, knee problems, but you can also explain what you have done in the bill for your, what do we say, in the bill for your patient, writing there was an inflammation in the mucous membrane or in the periodontium. Everybody has, every patient has. You can do this manipulating of the needle if it doesn't work. Better is to change a little the direction of the needle. Sometimes I take out the needle, not totally, but that the needle sticks still in the tissue, but I draw it back a little and change the direction, especially also in ear treating, in ear acupuncture. And so I change the direction and then the effect is improved.
How long should you normally leave them?
I leave the needles normally for about 20 minutes. Most of you may have 2 rooms or 3 rooms with dental chairs, have you? In Germany most have 2, 3 rooms, so you can have patients sitting in the same room and you go to the next patient and after 20 minutes you return and can finish treatment by taking off the needles. Okay.
Take a break for 20
Yes,
minutes?
yes, I think now we break.
25 minutes, we'll take a break. And come back at 4, please.
I have a right artificial.
first,
I
but
guess was
you just
looking
have to
for the
probe,
naming, the thing.
probe with a
but-
ball burnisher and then
Yeah.
go into there.
So, can you go on?
You are something special.
Oh, thanks, bud. You're a very nice group.
Well, yeah, we
You're very
appreciate
nice,
it.
bud.
We appreciate you being here and just the talent that you have. God bless you. I'm fascinated by your
Thanks.
work.
Very nice.
Once he starts, people come in.
Now let's go on.
Let's go.
There's still so many things to talk about. Some experience now during the break time. We had some treatments done here, but many of you have been here and you could see it is the same procedure every time. To look at the very point, needle is, one of you said, sucked in. Dropped, yeah, as if it might be sucked. So if you if you strike the right point, you have this special feeling. And the autonomous reaction is very typical. And two other have been treated with these points here in this area. And where's a lady, you were so cold, was it your story?
Yeah, you were too, except
Yeah.
nobody could take care of you. So.
Yeah, we had the same stress.
Situation. We came on the plane and we were very cold and
I was so cold for 2 days here.
and
Just
we don't sleep at night, waking every 15 minutes, waiting for the morning to come. So doctor did some treatment on me, whatever showed, and I got much warmer. But after the treatment, what happened? I couldn't really. It was difficult for me to get off the podium because my knees were collapsing.
this is very important to know. Say once more, she was very weak in her knees.
I felt like I had the.
Therefore, treatment had to be done in lying position. What we do in seminars is a very big fault, what we do. It's a mistake. We have no table here to have the patient lying down, and in my practice, in my office, patients lie down and they keep lying for half an hour, 20 minutes is the minst. And the most active acupuncturist we have in Germany, he has a practice with 80 such tables, 80 tables. 7 doctors, 3 Chinese doing the work, and each patient has a room for 1 hour. First to be a little relaxation, and then doctor coming, needle for maybe half an hour, 3/4 of an hour, and then take it easy. You can go up after 10 minutes. So 1 hour a room for a patient, I think it's perfect. And if sometimes patients coming in my office say, "Oh doctor, I'm in hurry, I have another appointment this day," nothing. I say, "Go home another day." It doesn't help if patient is in hurry. It doesn't help. I have seen also Chinese doctors send patients home if they didn't eat regularly, if they didn't eat warm meats every day. So they go home, eat normally, regularly for 4 weeks, and then you return for a treatment. So it's very good teaching for us to learn. Patient had to be relaxed, patient has to be time, and this is a very important factor in acupuncture. Now,
Another thing that I can add what happened actually a little later, past that point. I mean, remember this post that you were touched? I think it's small intestine, maybe something else, or
yes,
what?
it's small intestine.
Right. So it's itching.
It's itchy. Yeah.
It's itching to the extent that I guess my superficial skin is all
Yeah.
on both sides actually. So.
I put a needle there. I think not.
No, you were just
Just dabbing. Just dabbing with a needle.
And you said that was enough.
Well, yes, it was enough treatment for her, just with a dabbing needle to give a little, impulses, little irritation out. Yeah. So just if you tell of this area, speak of this area, so we can go on with this. For I believe it's very important for you. I can't explain for the beginners all the meridians. It's not. We just talked about large intestine, and this is just a little area of small intestine. But this is an area which is much important for dentists. For we have learned that there are points, especially the point number 2. You see the point number 2 is in the middle. You can give your lamp on it. You have it? So, yes, yes, this it is. This it is. Wonderful. You can do this. So, fine, thanks. This is the point. I treated the patient, and I believed I would treat number 3, but I put the needle not in the right place. I put it here instead of here. I didn't be very aware of what I did. But so the patient told me, oh, I can open the mouth so much as never before. So another situation, 2-3 weeks later, I came to Hamburg for a seminar with doctors, and they came in the break, as it is normally, people coming in break time. So asked me, this doctor had an accident, and both zygomaticus had been fractured, and sinus opened and all these problems, and he just came from the hospital, had left hospital 3 days before, and he could just open the mouth a little and had very much pain when opening the mouth. And it gave a little noise. You hear the little noise. So I said, we can have a try. And I put the needle at this point, and he opened. The noise had gone, the pain had gone. It was the best case I ever had. They don't repeat every day. Sorry to say, but it was a nice story because the doctor took his card, this one, name card, and so he was a dental surgeon. So he came from the clinic, from the hospital, where he had been trained as a dental surgeon. His professor treated him and said to him at the last day, now be glad that you have survived, that you can open a little your mouth, take some, what do we say, Spatel. Such a, take some, yeah, and try to, to get it open more and more. Maybe it works a little or so. But just a needle at this point, and it happened. Really, it happened. So I've seen many patients since it's now 3-4 years ago that I had this experience, and many dentists use these points now in Germany, and we have introduced this point in 2 university dental clinics in Germany, in Dresden and in Munich. And there are 2 doctors, his name are Dr. Promotions, young doctors who get their entered. So they do this work now for research work. So it's a possibility. Another point for the TMG is situated in the earlobe, but you can combine both points. This point, it's nearly number 2, standing here, or small intestine number 2. But it's very simple to find out this point because this is a basic joint here in the 5th finger. And there are 2 folds. And these 2 folds are like a V. And the distal fold is a fold of the muscles for mastication and for the TMG. And the proximal fold, this is the number 3 point, is for the cervical spine and for the spine at all. So you can use both points in combination in many cases, because many of our patients with troubles in the TMG, they have at the same time troubles with the cervical spine. So look at this region, number 2, number 3. Sometimes there are points very, very sensitive between. So we have discussed it more and more, that we have not only the Chinese points, we have lots of satellite points. You see all the many points. They can be here, here, and any places. We have much, much more points than Chinese had listed up in their books and in their meridians. So look at the points. I have learned that in this area between number 2 and between number 3 in this area between the two folds. There can be very sensitive points on one hand, either left or right. Very seldom on both sides. And if this area is so very much sensitive, you can overcome by these points obstacles, hindrances. When you had non-responders in neurotherapy, in homeopathy, in acupuncture, they are non-responder patients. And often that they are blocked mentally. Blocked mentally, they have, you understand what it is.
Yeah.
They don't believe in it, they are without any hope, no hope patients. And if you try to give a treatment in this area, in many cases I've seen you can overcome just for this situation, these obstacles. In another week it can be the same again, so you have to repeat, but have a look at these areas. Some of us have not only two folds here, but a third one in the middle. So be not irritated, it has to be directed to the fold most distally and most proximally. If there's a third fold in the middle, it's not so important, but this is number 2 and this is number 3. In Chinese books, there stands that the number 3 is at the end of the fold, but in my experience with a very point technique, it's more proximally. There's a little wulst, what is a little bulk. Yeah, yeah. Around this is a little bulge. And at the proximal side of this, you will find this point. I will demonstrate 2, 3 of you, and you can look at the points. So have a try for all your patients, not only in TMG problems, in problems of parodontopathies. Before you have an impression for a denture, try the best that all the tension in the mastication muscles have gone, have been released. So if it is sensitive, put a needle here. Use the technique you have been taught today and yesterday. Use the technique. Maybe the point is situated here, maybe there. Maybe there is another point here, so to run 2 needles. Sometimes there are 3 needles in a line. This is the most important point. Maybe another point here. So you find the third point just in the same direction. 1, 2, 3 in a line. Or 1, 2, 3 in a line in this direction. Many, many possibilities. But look for this area. It's a very important dental area.
How do you tell the depth of the needle? How far?
I never think of it. I wait how deep the needle is sucked. Sucked? Sucked in. I wait what happens.
Gleditsch is so
If-
tuned, he's so tuned that he just allows the
Yes.
needle to do the work.
Thanks.
He doesn't even think.
I don't think of it.
In fact,
Fine.
it's interesting, Dr. Gleditsch, you just treated Dr. Palos here for an elbow
Yep.
condition, and he came to me to do codes on him, and so you only put 1 needle for his elbow. I went to measure his pulse. I thought he had all the numbers on it because I said, there's nothing wrong with you. With 1 needle, Dr. Gleditsch was able to complete a regulation, or what I call 0 point, with 1 needle. That's a true master. If he can do it with 1 needle and balance all the acupuncture, this is the like one homeopathic remedy in
One
many
remedy.
cases.
One remedy.
I mean, he did it. I mean, Andy's over here, and he came over to try to see if we could balance them out. There's no balancing needed, so there's no work needed. He did it. He did it with 1 needle.
And my treatment does never begin in my thinking. You have learned it. My treatment begins asking the body, asking the skin, and I am told by the reaction of the patient where it is to be treated. I am told. I learn by every patient. I think in many of our treatments we are thinking too much. I will do it because my mind says it has to be. No, the patient knows. His unconsciousness, his deeper knowledge is it. And the deeper knowledge is the autonomous. It's the autonomous nerve system. And therefore we have such a very strong reaction, sweating immediately and such. So ask the autonomous nervous system. I used to say the autonomous nerve system is the most ehrlich, honest one of all our tissues we have. It's reliable. Is it? Yeah.
Is that because we can't change the reaction
Yeah.
until it happens?
Yeah. So I just will treat 1 or 2 of you with these points, and then we go on. Any one of you with a little problem in the TMGs or muscles of mastication? Who will be the patient now? No one. Thanks. Thanks that you can.
He's too busy to treat us.
So, the best is the lying position, but again we have to do what is possible in a seminar house.
Pain on the shoulder, does it hurt all the time or just when we
Eating, I find myself, like, because I get stressed clenching during the day. And I just sometimes don't notice it until the end of the day. And then I go to sleep.
Clinching.
she's angry with her
Now I ask, look here, if you would paint it on, please, you can paint it. There are 3 lines. You can do it right, maybe on the board. Do it on the board, maybe. So it's 3 lines. Or we can put it here. If it's yeah.
1, 2.
And she has a middle. She has a middle line. Yes. And so we look at the peripheral, the distal line, and ask here if there's any sensitivity.
She has an extra bolt right here, small one. I need needling right in here.
What's the problem? Clicking, popping,
And no hurry. Take it easy. We have time.
What are your symptoms?
How do I describe? Right there.
Not special. It's more the left side, right side, both sides.
I have to think about it now. More the right side.
So we look at the other side. Very important, learning to let. Not only to do, but also let. Let go. You see? Have you seen? Situation.
The winds?
Yeah.
Was a very, and the needle at the same moment dropped, sucked in. It was not so deep. Maybe I can have a little try if it goes deeper, without special pain. This direction. I have to look for the direction. In this direction was not possible. I can demonstrate it. Vertically, not, but a little tangential, little. So now it dropped very painful or not painful?
No.
Not painful, okay. So we had the first needle. It's very difficult to, if there's no special pain or so, but if a patient had a pain before, in many cases it is diminished or gone immediately. When you stuck the needle at this place. We have another needle dabbing, needle detection in the surrounding. If there is a problem with the cervical spine too, it might be sensitive in this area.
Give me neck pain though?
Yeah, he is.
Yeah.
That is most.
Right there.
Here it is. So,
I just felt like a release across my face.
tell it.
Say it
I
again.
just kind of felt a release right across my face. Through here.
Did you understand?
I just, as you put that in, I just felt like a release across here,
Yes.
across my face and my neck.
So,
Just as it went in.
we can have the needle still sitting here, and you can please go around a little bit. All possible? That you demonstrate a little the position of the needles?
Your face looks like you have more circulation. You're blushing because you were pale. You were pale when you came out.
Yeah.
If it would be a severe problem, there would be another point in the earlobe, a point around here. Sensitive?
Yeah.
Here it is. I can feel with the finger.
Was it,
I will demonstrate later on. But just now, these 2 points. Look at these 2 points. Thanks for your help. Thanks that you have been coming. Yeah. For these of you who are more advanced in ear acupuncture, to demonstrate,
That's the laser for that.
oh yes, to demonstrate how you can find the point for the TMG in the ear. There's a little incisor, little notch between the anthelix, and the antitragus. The little notch. And from this notch you have a line drawn till the helix. And this point, many of you may know it, it's the point, the relaxing point, or Jerome point. And from this point you go caudally. Along this line, till you come to the horizontal line, which is given by the caudal part of the incisor and the tragica. This is incisor. The caudal line of this. You see it? So I go down. This is a.
Mark it?
This is permanent.
Yes.
Have you
Yes.
a non-permanent? These are all permanent.
Here, this one is
Oh, that's fine.
a bigger point.
Very good. So if I have a line here, this area would be the area. Can you see it?
Yeah.
This area would be the area of TMG. Once more, the horizontal line is clear, and the vertical line, you begin with the inch.
Notch.
With a notch between anthelix and antitragus, and go in a little fold. We call it the post-antitragus fold. You go up till you meet the helix. And then this is a very important point too. It's a point for relaxing. This point here. Relaxing point. You can put it. So this would be relaxing point. And from this relaxing point you go a little caudally till you meet the horizontal line. And so you find the TMG point in the earlobe. I can put a needle in one of your ears and so you will see it, where it is. So we have 2 points. The relaxing point is the upper one, and this here would be the TMG area. Better to say an area and a point. Relaxing. Okay? So we have 2 possibilities treating TMG.
You call that the Jerome point, Doctor?
Now, if we talk about TMG, TMG underlies 3 conditioning factors, according to acupuncture, in my opinion. And these are 3 meridian lines, vertical lines. And these meridian lines are to be seen in this one. We have only 3 such very, very long meridians. This is the bladder meridian, the gallbladder in the middle, and the stomach meridian to the left. Only 3. All the other meridians are short meridians, but 3 super meridians. Super meridians. What is the difference between these 3 meridians? Look at them. not mentally, but just holistic.
Very irregular, this one.
Yes, phenomenological. I will demonstrate what it means. This is only on the left side, but we have meridians on both sides. So there are two other lines on the right side too. That means that all the back is covered by plenty of points. If you imagine that there would be two more lines on the left side too. So all the back is covered with a plenty of points. And that means, I will demonstrate it to you. That means this. What is it? I am protected in my backside. My backside is stable. Stable? Stable?
Firm?
Yes, stable. It gives security, it gives safety, it gives protection. It's clear. So the backside is very important in treating all these problems. And in TMG problems, that means if there is a problem with the spine, we call it for gnathovertebra, use the same words, gnathovertebra problems. Gnathovertebra. Gnathovertebra problems. So it's very important to have points for this system. But this system is a system of the fifth toe. And we can treat the system not only by the feet, but by the fingers as well. But which finger? The same. What is it? This one. And this one we did demonstrate just now. It's a small intestine, and we have learned which points can be used. So all the system can be treated here by the fifth finger, because all these lines end with the fifth toe. So you understand the systematics in acupuncture. Aligned, a vertical direction. Vertical in the upper part, it's named as small intestine. But small intestine and the bladder meridian, both together, could be called the dorsal system. The dorsal system, composed of two different meridians. In the upper part, the small intestine. In the long direction, the bladder meridian. But better, we could call them the meridian for posture. Posture, standing upright. Posture, for statics, for stability, for all these factors. And stability means safety, security, means protection. What did Chinese talk about it? Fear. They said fear. But fear means there's a lack. There's a lack of safety. There's a lack of security. There's a lack of protection. So if we use the abilities our body gives us, so we have all these fine mechanisms in our body. How we can call it. So just the first one. The next one. What is it typical in the next system? The middle system. Look at it. Yes, loud. It's laterally. It's laterally. What more? This is very strong. And this one is like a spring. Like a spring, like a fjeder, a spring, yeah. It's very dynamic. You see that there's a dynamic in it. It's like a spring. Very dynamic. And so it's quite another factor in it. And which factor may it be? It's all our personality. We have this personality, we have the other one too. We have the need of protection. We have the need of being free. And what is to be free? To be lateral. This is lateral. You understand? Even my dog understands. so That means I need some place for myself. Here I am. This is gallbladder. Chinese, what did they tell us about the system? Anger. Ross. Rage. So anger, rage, okay, aggression, whatever we call it. But primarily, it's a wonderful ability in it. The ability to act, to be dynamic, vitality. It's really a very vital system. It's a system of emotions. So one system, and Chinese told us that this system, the dorsal system, is connected with bones and skeleton. Skeleton is all our vertical system here. It's like a hard structure in it. But this one, the middle system here, is connected with tendons and muscles. Tendons and muscles is dynamics. So we have interpreted two systems, but the third system is the ventral one. And what is ventral? Quite another. What is ventral? Is that what we do?
Have sexual intercourse.
Yes, we meet.
Right.
We meet. We are confronted with one another. To be confronted with. Not only with a person, to be confronted with a task, with a problem, to be confronted with our profession, confronted maybe with our partner. We are confronted with many factors, with our own health. So to be confronted with is the problem or the deeper ability in the ventral system. Ventral means, venter is the stomach. Ventral system, stomach. It's the stomach meridian. So please understand that there are very difficult abilities in each one of the system. Once more, this is connected with bones and structure and skeleton. But this in the middle, the gallbladder system, is connected with dynamics, and they are activated by tendons and muscle activity. And the third one, the ventral one, the stomach meridian, is connected with the connective tissue. The connective tissue is the intertissue, or the interstitium. What is between? In between. In between cells. So it is a system which has to do with in between, with integration, we say. Yes? So it's the integration system. Now, once more, this one. Here we have it. The dorsal gives resting, gives support, protection, spine, bones. The lateral, dynamics, power, muscle, tendons. And the ventral, processing, efficiency, or integration as we taught it. And connective tissue is also the disc. So our TMG is depending on the spine, on the posture, on the posture, spine and posture, especially the cervical spine. Our TMG is depending on our muscles. Think of bruxism, parafunction,
Abnormal.
yeah,
Paranormal.
kneeling, and all this hard work with the muscles we do. And it is also very much combined with the processings on the ventral. And the ventral is a stress system. All kinds of stress. In Chinese, the ventral system, the stomach system, has a special problem too. I repeat once more. The dorsal side was security, safety, but Chinese said fear, anxiety. The lateral system was dynamics, but the Chinese said anger. If I am too aggressive, but primarily it is a very fine power in it, power, dynamics. And the ventral system, the Chinese told us it is worry. 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 Worry.
W-O-R-R-Y.
Yeah.
right?
Yeah, worry. How do you spell it? Worry?
W-O-R-R-Y.
Yeah, yeah. And what is worry? I think too much about it, and I was pondering about it. Yeah?
Well on it.
Yeah. Maybe or all. I'm critical. And this is a problem, patients in our practice, you know. Oh, they have a problem with the ability of integration. If you have a denture, they say, that's not okay, and this is not okay, and this is not. They have problems with integration. And in most cases, they are very intelligent persons. This is a thinking person. It's a mental person. But the mental person thinking too much worry. This is a worry. So we have the problem with it. So again, I give you another.
So we should make benches for stomach strain for Indian people. Stand up to perspective.
Yeah. No. You have to learn how to handle them, how to treat them, what to do with them. You see, once more, we begin on the right side. If you let to the left. The right man. The right man is the dorsal man. Fifth finger, you see it, and fifth two. Fifth finger, fifth two. This is the dorsal system. Whatever the names is of the meridian, there are many beginners here, I will not tell you too much. But just, you see the systematics. It keeps the same line, fifth finger, fifth tooth, and that means dorsally. And dorsally is spine. And spine is posture. And that means for the TMG, gnato vertebra. Gnato vertebra.
Gnat, G-N-A-T.
Mouth.
Gnato vertebra. Okay.
One for the insurance company, isn't it?
Yeah, get that coded right.
Yeah. The next one, the lateral person. It begins with the fourth finger. You see the fourth finger, the ring finger. And the fourth toe. So again, it's like a line. Like a line from finger down to toe. And the same system. And the third one, the ventral, the stomach meridian as we call it, begins with the second finger. Which meridian was it? Okay, large intestine. And it ends with the second toe and the stomach. Again, a vertical system. So we call it for three vertical axes. Three vertical axes. And all the three axes are in the head. Here they are. Ventral, lateral, dorsal. This ventral means face or front. Schläfe, that's temporal. And occipital, you understand. So, we can take the red one. If you keep it. Our TMG is here. And is managed by all three axes. There's no other joint which is so much involved in all three axes like the TMG. And therefore, many orthopedists now say that the temporal mandibular joint, the TMG, is the leading joint of all the organism. It is. You have to understand it. If this is okay, all the other problematics in the musculoskeletal system will be better, can improve. So you have to do a very good work. But what can we do for the dorsal system? We have to look like the orthopedics doctor says, for example, you say here, my hips, this is not the right thing. It's, what do you call it? Yeah. Torted. It's torted. So there's a problem here, must be. Clear. But I have no pain by it, so it's okay, I can live with this. But if I have problems, I can be treated here by this area. Fifth fingers area. It works. If you have problems with the muscles, Knizzling, clenching patient, bruxism patients, we can treat the muscle spasm, the muscle tension. How can we treat it? One of the points we have seen just now, it was the upper point, this one, in the ear.
Relaxation point.
Relaxation point.
Like that.
There it is, wonderful. Relaxation point. You can do it. You can treat in the oral cavity. Remember what we told yesterday. In the retromolar space, upper and lower jaw, because there are the reflex points for all our muscles for mastication. For pterygoid, masseter, temporalis. So we can do it inside the mouth with very small injections, as we did yesterday. This for this system, for the system in the midline, the muscle or dynamic system. But for the patient, also very important to have some relaxation trainings. Some of you may know what it is with Qigong. Have you heard about Qigong? These are the Qigong patients. Very, very well done. Or autogen training. You know autogen training? Autogenous training? Autogenic. Autogenic. So it's very important for these patients. But now, the ventral have never been discussed before. That the ventral system is very important for our patients too. For this is the system of the face, this is the system of the stomach, this is the system of integration. So again, the stress patients are most suffering from these problems. So how to diminish the stress of our patients? Think of the word worry. Worry, you understand, no? W-O-R-R-Y. The worry patient, you can help them, they have to change their thinking. You have to teach them a positive thinking. It's very important. We have learned by Dietrich, Klinkert and by Ara today so many fine methods, but you can do whatever you like also in kinesiology or in testing with fine nosodes according to full electroacupuncture. But I've seen if patients don't change their thinking, you can do whatever you like. You have tested them, you have detoxificated them after 2 years coming again with same problems. Patients have to change. For this patient, the ventral one is an intelligent one. And they can think about it. And they can change their thinking. You can recommend some books. You can give them some CDs with a fine relaxation training or so. You can teach them that they have to change their stress in a way. But again, Qigong is a fine method for them too. And then all dentist work. They are very depending on that what we were taught this morning by Dietrich and Ara, that the occlusion. Patients have really a very critical situation if the occlusion doesn't work perfect. They are perfectionists. Critical persons are perfectionists. And therefore the perfection is a problem within the mouth. Chinese say that the ventral system is correlated most with the sense organ of the mouth. The lateral system is connected with the eye, and the dorsal is connected with the ear. So again, we have the mouth here included in the system. So all the problems, all the stress problems, all the thinking problems, they are most concentrated again in the oral cavity. That's our problems as dentists. So we have big, big problems to overcome all the problems with these patients. But I've seen they are sometimes very difficult patients because they have problems with integration, also integration of their normal occlusion and so. But we can talk with them, we can change their mind, we can train them that they are positive thinking, and so it gives a good help. I have another.
Do you do any acupuncture on
Yeah.
the anterior line?
We didn't talk about the ventral system, how to be treated. The ventral system is very well treated again in the oral cavity. And think of it, beginning, second finger is large intestine. Hegu point. Point number 4.